Chapter 31: Schizophrenia and Other Psychoses. Psychosis is the inability to recognize reality, relate to others, or cope with life's demands. The key word to remember when we're talking about psychosis is that there is a disconnect between the person and the mind to reality. The most common psychosis is schizophrenia. Schizophrenia involves the most complex and frightening symptoms. For example, the individuals may hear voices, think that other people or machines are controlling them. Some of them even feel like there's like bugs crawling on their bodies or believe that other people are plotting against them. Schizophrenia is not a single disorder, but rather a group of psychoses. Some other psychotic disorders are like your brief psychotic disorder, which is like the acute part of psychotic disorder. And then you have a delusional disorder and psychosis that is related to medical conditions or drug use. The continuum of neurobiological responses, again, affective responses are highly adaptive, and then those destructive behaviors are called maladaptive behaviors. Those individuals who do not adapt as well are placed at the middle of the spectrum. Psychosis throughout the life cycle. Psychosis in childhood, there's like what we call failure to thrive syndrome, whereas there is like a slow growth um, physically, and there because of that, there's an inability to integrate with the physical, emotional, and sensory motor realms of functioning. Most of the time, this failure to thrive symptoms has is related to neglect, environmental problems, and severe family distress. Risk factors for childhood schizophrenia is number one is genetic influence. So research has showed us that those children that actually is born from parents that have a history or diagnosis of psychosis, they are at high risk to actually develop psychosis as well. Another risk factor is a complications during the pregnancy or birth and biochemical imbalances. So like imbalances of those neurotransmitters, serotonin, dopamine, right? Those are when the imbalance happen, then there's a risk factor for schizophrenia that happen in childhood. Psychosis in adolescence, the average teen is in contact with reality. The patient or the adolescent with schizophrenia, again, there's no contact with reality. The manifestations that we're going to see will be there will be changes in behavior, like poor hygiene, the way that they talk, they have like a strange, vague speech. Social withdrawal. Remember, adolescents, they actually love to have and build those relationships outside of the home environment. For psychosis in adolescents, they actually are the ones who loves to like withdraw from society or withdraw from other relationships. So they will have social withdrawal. Odd behaviors, bizarre thoughts and beliefs, again, because they don't have that contact in reality, and unusual superstitions. Psychosis in adulthood. The onset of acute symptoms most often occurs in men during their middle 20s, while women usually present with symptoms in their late 20s. Prognosis for individuals with schizophrenia is better if adaptive interpersonal relationships and acceptable school performance and work histories were in place before the onset of symptoms, meaning that even before they actually have that onset of the symptoms, these people that actually have those very strong support system, right? Because they have an adaptive interpersonal relationships, they do very good in school, they actually do very good in work histories, and just overall in general they have a good support system. So when the onset of symptoms actually happen, the prognosis for those individuals are good. Psychosis in older adulthood. Schizophrenia is seldom diagnosed in older adults, and those that are diagnosed actually may spend the remainder of their days in like long-term care facilities. Acute onset of psychotic behavior needs further investigation. Okay, this is not normal for any elderly client for them to have psychotic behavior. So if we see an acute onset of psychotic behavior, then we have to investigate further. One example could be a possibility of UTI, right? If you have a patient that is alert oriented times three, and then the next day that you come back to work, the patient becomes confused, forgetful, right? This is acute onset, or maybe they were actually even acting out, refusing their medication, refusing their care. So those are acute changes in the behavior. Now we need to actually investigate. For example, maybe we will try to do labs, right? Check for infection, maybe check and collect urine for urinalysis and culture and sensitivity, so that we can check if there's like a UTI that is going on, infection in the urine. Schizophrenia exists in all cultures and socioeconomic groups. We have some theories that is related to psychosis. One is biological theories, which believes that the effects of stress on the individual, especially during the prenatal period, has something to do with developing the psychosis. The stress, disease, or maybe trauma, like traumatic events, can also lead to psychosis. These theories believe that they could lead to psychosis. Neurochemical models, as I have mentioned earlier, neurotransmitters such as the serotonin, norepinephrine, and dopamine, they have been implicated as possible causes for schizophrenia. Psychological models, schizophrenia is caused by basic character flaw combined with poor family relationships. And then your socio-economic, social cultural theories rather is believing that the effects of the environment may lead to the development of psychosis. So the social cultural theories believe that it has something to do with the environment that's actually um, causing for that psychotic episodes. Subtypes of schizophrenia: catatonic, disorganized, paranoid, undifferentiated, and residual. What are the difference? Catatonic, this is characterized by a lack of or peculiar motor movements. Okay, it has something to do with peculiar motor movements. Disorganized is when the patient is showing the most psychological disorganization and lacking a systematic set of delusions. For paranoid, this one is characterized by delusions of persecution, the belief that everybody is out to harm the patient, or everybody is out to harm the person. And then undifferentiated is for those that do not fit into other of these subtypes, like your catatonic, disorganized, and paranoid. Residual is a mild form, that occurs after at least one schizophrenic episode and does not have prominent delusions or hallucinations in all of those manifestations of the schizophrenia. Signs and symptoms and behavior of schizophrenia. The main characteristic of psychotic disorder is the loss of contact with reality to the point where functioning is grossly impaired. The signs and symptoms of this schizophrenia is affecting the perception of the person, the physical appearance, cognitive processes, language, speech, emotions, behavior, and social realms. There is like what we call positive symptoms and negative symptoms. Positive symptoms relate to maladaptive thoughts and behaviors, and negative symptoms relate to the lack of adaptive mechanisms. Schizophrenia has phases for of becoming disorganized. This course of schizophrenia is marked by episodes of acute psychosis alternating with periods of relatively normal functioning. Symptoms of schizophrenia before we can actually diagnose must occur for at least 1 year. The slide into schizophrenia commonly occurs over 4 stages: prodromal, pre-psychotic, acute phase, and remission. All right, let's go over them one by one. Prodromal phase is a period between the incubation and illness when a person begins to show early signs of the illness, but the symptoms are not yet specific or diagnosed. Pre-psychotic is the period before a person is diagnosed with psychosis. During this time, the person may experience a range of non-specific symptoms that can lead to growing functional impairment. Acute phase is the early phase of the illness. It is characterized by the onset of the symptoms. And then remission is when there is a decrease in or disappearance of the signs and symptoms. Okay, so please remember these stages of the the schizophrenia is the prodromal phase, pre-psychotic, acute phase, and then remission. Again, other psychosis we did talk about earlier on is the brief psychotic disorder, which is a psychotic disturbance that lasts longer than 1 day but less than 1 month. Delusional is characterized by more than 1 month of non-bizarre or reality-based fixed ideas. Shared psychotic disorder is when the individual is influenced by someone else who has an established delusion. And schizoaffective disorder is when the depression or mania is also present. So, how do we actually help these patients? How do we manage? What we do is to stabilize the patient and prevent further decline in functioning. Then we assist the patient in coping with the disorder. Long-term goals include psychosocial and vocational rehabilitations. So we actually have to get a lot of IDT or interdisciplinary team involved, like your therapist, right? Psychosocial therapies, maybe social worker, psych doctor, the nurse, right? And all of those, maybe therapists too. Um, could also join us for the long-term goals. Pharmacologic therapy, what medication do we give for the patient? We can use antipsychotic or neuroleptic because these medications actually slow the central nervous system. And after an antipsychotic drug is taken, hallucinations and delusions will decrease, the thought process will change, and hyperactivity will subside. However, again, please remember that when we're giving medications, we are also monitoring them for side effects. Antipsychotic is big with EPS, or the extrapyramidal side effects of the medication, which is your akathisia, your agnosia, your abnormal movement, the tremors, the lip smacking, right, the tardive dyskinesia, and all of those side effects that we have talked about before. Nursing process, there's going to be a disturbed thought process, disturbed sensory perceptions, social isolations, impaired communications, and ineffective management of therapeutic regimen. The basic goals of care are to assist the patient in controlling their symptoms and achieving the highest possible level of functioning. So again, the most common side effects of the antipsychotic medications, because it does like an alteration in CNS and the peripheral nervous system. So we're going to have extrapyramidal side effects, sedation, anticholinergic effects, akathisia, akinesia, bradykinesia, dyskinesia, dystonia, and neuroleptic malignant syndrome. These side effects are in a box in chapter 7. So if you want to go back to that chapter and look at that box and see actually and try to remember what are those akathisia, akinesia, and all of those things. It's there. Okay, nursing responsibilities. The nurses should review the desired action, side effects, and incompatibilities of each medication that is prescribed for the patient, and also we monitor and document the patient's response to each medication. Patient and family education has a direct impact on the client's level of functioning. And again, please remember that before we start those medications, we actually want to make sure that the patient and the family is involved, because they should be the one that's giving us consents before we can even give those medications to the patient. Question 1. The nurse is caring for a client who states that she has never been able to experience pleasure in life. The client's condition is known as what? Answer is 4. Anhedonia. Again, these terminologies is available in the book, chapter 7. Question 2. The nurse is caring for a client who has an inability to sit still. The client feels nervous and jittery. What is this client experiencing? Answer here is 1. Akathisia. The nurse is caring for a client with schizophrenia. Her client has had at least one acute episode of schizophrenia and is currently free of acute psychosis, but is having negative symptoms of withdrawal, emotional changes, disorganized thinking, and odd behaviors. What type of schizophrenia does the client have? Answer here is 4. Residual. Keyword is that the patient had at least one acute episode of schizophrenia, but is currently free of acute psychosis. Question 4. The nurse is caring for a client who is in the process of sliding into schizophrenia. Her client is withdrawn, lacks energy, and has little motivation. The client is in what phase? Answer here is 1. Prodromal. The client has just been placed on antipsychotic drugs. It is important for the client to know that it may take how long for the drug to become effective and stabilize the behavior. Answer here is 3. It takes weeks before those drugs actually become effective and stabilize the behavior.